So Asian Healthcare Foundation was an offshoot of AAG Hospital. AHF is built on, of course, it's patient-centric. Whatever we do is because of the patients, and whatever we do should benefit the patient. The second important component is the research component, what we have actually started doing. Basic fundamental research, but what we have to do is translational research. So we concentrate on translational research. The third component is community service, and again we are very keen on this. We believe that in our country, many of the patients cannot come to a tertiary center like this, not only because of the lack of money, but also because of the social factors, coming to a big city, staying somewhere, seeing doctors.
There are so many hindrances, barriers. There are so many women. It is difficult for them to reach the so-called city, towns or big hospitals.
So what we decided is that we go to the doorsteps of these people. So we started building these large vans which contain endoscopy, ultrasounds, point of care labs and all, and then going into villages. And for the last 20 years we have been doing this work, much more in 10 years. And we found that the disease pattern in our rural population is a little different from urban.
We are seeing the rise of lifestyle diseases. Lifestyle diseases like obesity is what comes to my mind first. Lifestyle diseases like inflammatory bowel disease, reflux disease, high incidence of diabetes, hypertension, so stress-related diseases. All this is now percolating from the cities to the villages.
We also found that many diseases which are evolving in these people have become full-fledged in the urban areas. So a lot of fundamental research came. In fact, we got papers in Lancet and other journals based upon this research.
We have a team of volunteers doing a house-to-house survey, and they identify people which requires, or patients or individuals who require additional help. They are sent to the medical camp, and in the medical camp we have doctors, we have nursing staff, we check their routine parameters, and then sicker patients are referred back to the hospital. AIG, with the help of Hemsley, has actually been able to do this, to go out to them, bring back information, diagnose, treat, and pave the way for the future.
But I think basically the rural population has benefited tremendously from this, because not only were they getting a very early diagnosis at their doorsteps without any charge, but also treatment which is very effective and given immediately there.
We have covered more than 200 villages across 5 districts of Telangana, and covering at least more than 1 lakh households. So you can imagine that it would be more than a few lakhs of people. Same model can be replicated in a bigger way across the country, and not only India. All of our neighboring countries, Southeast Asia and other developing countries can follow this model. So parallel to the entire program, our team, as I said, they have this passionate young people who also go into the villages. They are educating children about how to lead a healthy life. So it's fulfilling, completing the entire circle from early diagnosis, treatment, identifying the reason for these lifestyle diseases, and perhaps our little way of trying to prevent all these lifestyle diseases, including inflammatory bowel disease, which is such a chronic, debilitating condition otherwise.
I think motivation is not only these patients, but the satisfaction that they get when they're treated, satisfaction we get when we treat them. This is a strong motivation. I've had my initial motivation from my father, who was a pathologist, who always said that I have to not only be a clinician but also a research worker, also be an academician. and he's the one who's forced me into clinical work, research and academic work. So he's been the driving force behind what all I've done.